seeing people on a daily basis that live with diabetes. We help them with their medication supplies, so if they're on a medication to treat their sugar levels, we also help them with their insulin supplies, and then we also help them with the NDSS, or the National Diabetes Service Scheme, which is the supply of their test strips and needles to test their sugar levels on a daily basis, but also to help them with their insulin and injecting that. Even if you aren't visiting your pharmacy for your diabetes medication, it's really important every time you do visit the pharmacy and you might be getting something for cold and flu or a sore leg, it's really important you talk to the pharmacist and explain that you are someone living with diabetes, because the medications you are on may be affecting the other treatments that you're seeking. So the NDSS is, as I said, the National Diabetes Service Scheme, and what it does is supply patients living with diabetes their testing strips, which go in their blood glucose meter, in order for them to test their blood sugar levels on a daily basis. It also supplies them with the needles, which are the tips they use to inject their insulin, or also the needles that go into their pens to test for as well. So with the NDSS, once you are diagnosed as a person living with diabetes, the doctor will refer you to the NDSS, and then you'll bring that referral to your pharmacy, and what it does is subsidise those testing strips for you. So if you were a patient that didn't have that referral, those testing strips might cost you $30 or $40. If you are a patient that has that referral, they will come down to $15 or even less if you're a pensioner or concession card holder. So if you were someone that was newly diagnosed with diabetes or as living with diabetes, really important questions to ask your pharmacist are how the medications are going to work, how to take the medications, how often I need to test my blood sugar levels, how do I test my blood sugar levels, is there anything important I need to know? As simple as you need to make sure you've got clean fingers. If you've got sugar on your fingers, well, that's going to affect your results. Is there any other medications that I can't take? If you're a patient that's been living with diabetes for a while and are on multiple medications to treat that diabetes, we as a pharmacy offer a couple of alternatives to help you remember to take your medications. They are sachets or a Webster pack, and what they do is set out your pills for you on a daily and even hourly basis so you can remember to take them. And they're quite easy to carry around with you in your handbag or your case. Make remembering your tablets easier. As we all know, the importance of taking your medication to treat the diabetes that you're living with makes a huge difference. If you don't take your medications, we're not going to adequately treat your sugar levels and we're going to have further problems. So coming into your pharmacy and getting that support, it's going to make your life a whole heap better.